the AMA is in support of this bill, and I want to commend you and thank you. I'd like your comments on several points. One, what led AMA to lend its support to H.R. 3200? And we are hearing arguments that 3200 harms the relationship between doctor and patient. Could you comment on those 2 points?
Certainly, Congressman, and we appreciate your support of system reform over the years. The AMA, when we took a look at where the 21st century healthcare delivery system is, it's fundamentally broken for many Americans. And as a result of that, the physicians felt that it was time that we stood up for the uninsured, as well as trying to deal with some problems that we have in the Medicare payment system that was going to threaten access. So as our belief of support of H.R. 3200 was to continue the process moving forward, that status quo was unacceptable. With regards to the question, is there anything in the current version that we've seen of H.R. 3200 that would create the problem of interference between a physician to determine what's best for that patient? In the current version, we don't see anything that would prevent that doctor-patient relationship from continuing.
Could you comment just very quickly on the importance of the provision that allows consultation between the physician and the patient to be compensated on end-of-life discussions? How is that important, and does this give the government any inappropriate role in these conversations or discussions?
Well, under the current law, when a Medicare beneficiary enters the hospital, they're asked, do they have an advance directive? And if they do not, they're given a piece of their advance directive materials by many times a hospital clerk. We believe that's the wrong time to have that conversation. We believe the conversation between a patient and a physician on what the patient wants to happen if they have a catastrophic illness should occur when the patient's healthy. But because we're talking about the Medicare program, it takes an act of Congress to be passed to have Medicare pay for anything. And so as we took a look at a comprehensive health system reform bill, we felt that it would be appropriate to talk about what's fair compensation, to have a conversation not when the patient arrives at the hospital, but at the time when they're healthy in the physician's office, to have enough payment so you can have a quality conversation of what the person's beliefs, what they want to deal with, so that the patient's wishes are followed at a time of catastrophe.
And this causes you no fear about the safety or security of the patient?
None at all, because again, the current system, this is occurring every day. And we just think that there's a better way for it to occur, and that's as an outpatient at a time when the patient isn't in a critically ill situation where it's very difficult to have a good conversation.
Thank you, Madam Chairman.
Mr. Waxman.
Thank you, Madam Chairman. Mr. Potter, you